Today I wanted to shed some light on lichen sclerosus and what it is and what we can do about it. So lichen sclerosus is a chronic inflammatory autoimmune disease that affects the tissue around the vulva. Now, initially you might not have any noticeable signs, so you can't see any changes, but you might find you're getting a little bit itchy there, or it may feel a bit burning. But then you start to get some white spots that can then join together to become white patches on the skin around the anus, from the anus to the vagina, around the labia minora, and then it can even go onto the clitoral hood and then start covering the clitoris. And the symptoms that you'll have are, like I said, itchiness, burning, a thinning of the tissue where they start to feel quite fragile. You start to have pain with intercourse. You may even have painful bowel movements. You may have bleeding and fissuring of that tissue, so it starts to crack because it becomes so thin and fragile. It doesn't have that same extensibility that it normally has. You may also notice that you have a slower stream of urine, or that when you pee, the urine doesn't come straight down, it kind of goes all over the place. But there are other reasons for that too. Now, the tricky thing is, I think that lichen sclerosus is underdiagnosed, especially initially, because a lot of those symptoms, especially the early ones of burning and itchiness, can be something like a dermatitis or hormone changes. And often it is. So you might want to change into cotton underwear, or change your soap that you're using, or change your laundry detergent. And those are all great strategies if it is that. So we think, oh, I have some itchiness. Oh, I must be getting a reaction to my soap, where it's actually the start of lichen sclerosus. So when then we kind of let it go along too long, and then we start getting the white patches. When you do get a diagnosis of lichen sclerosus, either from your pelvic floor therapist or when you go to your GP or gynecologist, the first form of treatment is a corticosteroid. So they'll give you a cortisone cream, and you place that onto the areas where the lichen sclerosus is. And that helps to minimize the spread and calm those tissues down. And usually it takes within a couple of weeks, and you start to notice some changes where you have less of the symptoms. So if you do have alterations in the sensation around the vulva, you can have a look in the mirror. So check out your own self so you get to know what your own tissues look like and see whether there's whiteness. Now, having said that, a lot of us, our skin in the vulva is different colors. It can be kind of patchy. It's red, it's white, it's brown. So there are lots of differences. But lichen sclerosus, it's shiny white little patches around the area, or like in a sort of mottled area around the anus. So when you spread the tissues, instead of nice pink or brown area around the anus, you'll see like some whiteness, as though it's lost its color, right, around those tissues. So do go and just go get it checked out, because you want to get onto it earlier rather than later, so it has less symptoms or less destruction of those tissues where they start to get thinner and thinner and thinner. And like I said, getting the clitoral hood covering the clitoris, or the labia minora actually starts to become flattened into the rest of the vulva. Okay, I hope that helps to shed some information on it. And if you found this video helpful, you can push that like button down below.